Hi class, let's take a look at the pedal foundation and the foot. We could look at it from different perspectives. That's the medial perspective, and this is the lateral perspective. This would be looking at superiorly, looking straight down. So you can see that highest bone right there is the talus. That's going to articulate with the distal ends of the fibula and tibia, where you have your lateral and medial malleolus. And then there's your calcaneus. So the foot is made up of 26 bones. If we were to look at them, we would see the talus, the calcaneus, you have your navicular, then you have your first, second, and third cuneiform, also known as the medial, the lateral, and the intermediate cuneiform. You could see the first, second, and third cuneiform articulate with that navicular. And then laterally, there's your cuboid. And your cuboid is going to articulate with the fourth and fifth metatarsal, which takes us to the first, second, third, fourth, and fifth metatarsals. So you have 7 tarsals, 5 metatarsals, and then you have 14 phalanges. You have a proximal, a middle, and distal phalange of toes 2, 3, 4, and 5. There's always a proximal, a middle, and a distal phalange of toes 2, 3, 4, and 5. It's the first toe, the hallux, that only has a proximal and distal phalange. So when you add them up, you got 26 bones, kind of similar to the spine, right? So the structure that's helping you stand up tall and erect, right? That bone, that foot structure has 26 bones, and then your spine has 26 bones. If you think of it that way, 24 freely movable vertebrae. Then you have the sacrum and the coccyx, 26. Yes, I understand the sacrum has 5 segments and the coccyx has 3 to 5, but just think of them as bones in their entirety. Okay, and then you have that medial longitudinal arch, and then you have a transverse arch, and then you have a lateral arch. And the arches of the foot are really important. When you have a good arch, you have healthy structure, you have good shock absorption down at the foot. It helps the knee, it helps the hip, it helps the rest of the spine. Your foot is the first foundation, right? This is what you step on. That's the floor to the house. What happens to the feet dictates what happens above. So if you have flat feet, or pes planus, if that foot flattens and the talus, plantar deviates or goes plantarwards and flattens that pes planus, the tibia medially rotates. You have this slight medial rotation of the tibia in relationship to the femur, and then what happens over time is that you start to get this chemical degradation that happens where the menisci is, especially the medial meniscus, that can slowly degenerate over time by the torsion, right? When that tibia medially rotates, you get this torquing effect of the ligaments of the knee, the ACL, the PCL, the menisci, and this chemical degenerative process kicks in and starts to degrade the tissues. So a lot of the times as people advance in age from pes planus or flat feet, oftentimes they'll get knee pain and there'll be this medial meniscus degeneration or ACL degeneration or lateral meniscus degeneration. A lot of the times that starts down at the feet first, and proper arch support with spinal pelvic stabilizers or orthotics would be very beneficial. I'll also mention another condition called piriformis syndrome. Here's the gluteus maximus, and if we remove that, we can see the infamous sciatic nerve that goes all the way down under to the foot, okay? The sciatic nerve starts in the lower back. You could see, I think you could see there, the nerve plexus, right? That sacral plexus there. And from that, you could see the sciatic nerve piercing just inferior to the piriformis, which is an external rotator of the hip. So with pes planus, when the foot falls and you get that medial rotation, it can put a stretch on that external rotator, irritating the sciatic nerve, causing piriformis syndrome, which is a form of sciatica, right? When that irritates the sciatic nerve, you can get symptoms down behind the knee, you can get it to the calf, and you can get tingling down into the feet. So again, it just shows the importance of proper arch support down at the pedal foundation at the foot. Very important to get that good arch support taken care of. Heel spurs also can happen. If here's the arch and you have muscles that go the plantar fascia from the heel to the toes, think of this as like a bow and arrow. You know, the stronger you pull, the more tension that's there, the more it increases the arc. The less tension, the flatter it is. So if your innate intelligence is trying to increase the arch, it's going to pull and pull and pull. That plantar fascia pulls and pulls and pulls, and it starts to avulse part of that calcaneus, and you get a little heel spur. Okay, and that's where many of the orthotics do make heel spur corrections to help alleviate the discomfort. So when the heel strikes, it's hitting this depression in the orthotic rather than the spur hitting the soft tissue muscles, compressing the nerve against the hard surface during the gait cycle. It's during heel strike that becomes painful. Okay?